Hello everyone. This presentation will be about drowning. What is drowning? Drowning is defined as a process of experiencing breathing difficulties due to being submerged or immersed in water. It happens when water enters the airways, preventing oxygen from reaching the lungs and the brain. Many people think drowning involves splashing or calling for help, but in reality, it's often silent and quick. A child can drown in less than 30 seconds. And it can happen in as little as a few centimeters of water, even a bathtub, a bucket, or a pool. According to WHO, World Health Organization, drowning is one of the leading causes for accidental death in children under the age of 5 worldwide. This makes it not just a safety issue, but a public issue. How can drowning affect children and their families? The effects of drowning reach far beyond the incident itself for children who survive. Oxygen deprivation can lead to long-term brain damage, memory problems, or even physical disabilities. Many need months or even years for rehabilitation and therapy. For families, the emotional impact can be devastating. Parents often experience intense grief, guilt, and trauma, especially because drowning is so sudden and it can be prevented. Siblings may feel confused, they may feel scared, they may feel sad because losing a brother or a sister is not easy. Another one, financial strain is another reality. Hospital bills, therapy, or counseling can be very heavy pressure on the families. In many cases, the emotional pain and stress last for years, changing how families interact and how they view safety at home. In summary, drowning isn't just a water incident, it's a life-changing event.
Well, hello everyone, my name is Shanice and today I will be looking at drowning prevention. The first principle of prevention that I will be looking at today is learning to swim. Swimming lessons have significantly reduced the risk of drowning for people of all ages. The next core of prevention that I will be looking at is learning CPR. Immediate CPR can be the difference between life and death. So get certified and prepared to act. The most important core of prevention that I will be looking at is active supervision. Always designate a responsible adult to watch those kids in water without being distracted. Next, I'll be looking at natural water safety, and these include rivers, lakes, and oceans. It is very important to understand ocean currents and strong river currents before allowing your child to swim. Poor vision, poor visibility. Never allow your child to dive head first. Always enter the water feet in first, check the depth of the water, and check for objects like rocks and logs in the water. Next, I will be looking at man-made water safety, and these include pools, tubs, and spa. Always ensure that you have a 4-sided fence around your pool. Now the fence should be 4 feet high, should be able to self-close and self-latch. For non-swimmers, always ensure that they are wearing a life jacket whenever in open water or boating. Next, I will be looking at homemade water safety, and this includes bathtub and beyond. Never leave young children in the bathtub and supervise. Not even for a second. Always stays within arm reach. Always drain the tub immediately after use and ensure that the toilet is always closed and can have a self-latch. For items like tubs, containers, or buckets, always ensure that the waters are drained immediately after use and turned down. Now this marks the end of my presentation. Thank you.
Hi, I'm Gail McIntosh, and I would like to highlight an international case of drowning of a 4-year-old boy in the United Arab Emirates. A 4-year-old boy drowned during a class swimming lesson at the Australian International School in Sharjah, November 2018. During the court case, it was reported that the boy went missing from the changing room area after the swimming class lesson, early 2019. Safety risk, insufficient oversight, insufficient barriers along the pool area, parents' concerns and complaints being ignored by the school. Case outcome: The school was charged with criminal negligence. The school, its instructor, and its assistants was charged by the court and ordered to pay compensation to the parents, Ali 2019. The case received regional attention, and it was highlighted the importance of pool safety, school supervision, and preventative measures. Thank you.
Good evening. My name is Latoya Llewellyn. I am from Group 4, and today I'll be addressing questions 5 and 6 from Part 3 of our group presentation. Cultural factors can significantly influence the perception and management of risk by shaping attitudes, beliefs, and behaviors within a group or society. These factors determine what is considered risky or acceptable, how risks are communicated, and the strategies chosen to address them. As a result, different cultures may approach the same risk in unique ways based on values and traditions and experiences. For example, in some cultures, it is common for children to play near water unsupervised. There may be a belief that water is not inherently dangerous or learning how to swim comes naturally. Another example is that some parents believe that learning how to swim is an essential skill to learn. In general, community attitudes and social norms towards risk and collective responsibility can influence drowning prevention.
What can a parent do if a child is drowning? First, call for help. Get to the victim as quickly as possible. Move the child out of the water. With a head tilt chin lift, keep the airways open. Check for breathing. Check to ensure there is no item in the mouth of the victim. If there is no breathing, pinch the nose close with the thumb and the index finger using hand on forehead. Do take regular breaths. Give one initial breath. Watch if the chest rises as you give that breath. If the chest does not rise, repeat the head tilt chin lift and proceed to give 4 more additional breaths. Begin CPR immediately. Avoid delays. If it is an infant aged less than 1 year, including newborn, start compressions at least 1/3 diameter of the chest by using 2 fingers in the center of the chest just below the nipple line. For adults and children, place the heel of 1 or 2 hands 5 centimeters depth on the lower half of the breastbone, the center, and push down 2 inches. Remember, 30 compressions to 2 breaths. Continuously, with pause for breaths, proceed with 1 breath every 6 seconds, 10 breaths per minute. If there is no pulse and no breathing, 1 breath every 3 to 5 seconds, 12 to 20 breaths per minute. Check the pulse every 2 minutes. Continue until help arrives.
Hi, good evening. My name is Tashana Johnson, and I will be explaining 2 simple strategies for reprogramming cultural mindsets to reduce the risk of drowning. So firstly, learn to swim. And as a certified swim instructor, it is vital for children to learn to swim. And what we have done at the swim school is we introduce packages for preschools to have that be a part of the curriculum so it's mandatory for all children to come and learn to swim. And having them learn to swim at a younger age is amazing. They are fearless, so they learn so much faster and easier, and they pick up all of the life-saving tips and tricks that we try to give them for whether they are in a pool or in an open area. Secondly, parents and all adults should learn some form of life-saving skills when it comes to water and water safety, whether it be pool or ocean open waters. Having the basic knowledge of, in the event that something happens, how to save a life, how to use everyday items like a towel or a t-shirt to throw to someone to pull them out of a situation in open water or in a pool. And one cultural thing that most black people have heard at one point in time is black people can't swim. and that has been passed down generation to generation, and that needs to break. So on behalf of my group and I would like to say thank you for listening to our presentation on drowning.